Now, to complement government efforts in saving up to 1 million lives with twin objectives of improving healthcare delivery and achieving the Millennium Development Goals, the MDGs, the Private Sector Health Alliance of Nigeria, PHN, has unveiled the $1 million Health Innovation Challenge. Well, CNBC Africa's Uwana Ekpat spoke to Muntaqa Umar Sadiq, the Chief Executive Officer of Private Sector Alliance of Nigeria.
Today, the Private Sector Health Alliance of Nigeria, led by Alhaji Aliko Dangote, Mr. Jim Ovia, Mr. Ike Imokwede, Dr. Mohamed Ali Pate, and Mrs. Shola David Bora, convened a landmark event focused on three things. The first was around launching and showcasing a Nigeria Health Innovation virtual portal. Second is convening the first ever health innovation community of practice for the health sector in Nigeria. And the third is launching a health innovation challenge to save 1 million lives of women and children in Nigeria. We are touched by the genuine commitment of private sector leaders in Nigeria to mobilize resources, capabilities, and expertise to advance health outcomes through innovation and partnerships. And we believe that today marks a first step towards leapfrogging and enabling Nigeria meet its health goals.
What is the Health Innovation Challenge to save 1 million lives?
As a quick context, every year in Nigeria, it is estimated that approximately 1 million women and children die from largely preventable causes. Everything from your vaccine preventable diseases, diarrhea, malnutrition, for example, accounts for 50% of under 5 deaths. So this movement to save 1 million lives of women and children in Nigeria is a paradigm shift in the health sector from a focus on inputs to one that is additionally focused on outcomes and results. So what we're doing with the Health Innovation Challenge to save 1 million lives is to engage different health sector leaders and different stakeholders to develop problem statements that, if addressed, will help contribute to saving the lives of nearly 1 million women and children in Nigeria. So, for example, over the last few months, we have engaged all the 6 different zones in Nigeria to develop and distill priority problem statements. For example, in the northeastern region of Nigeria, where we continue to have crisis and security challenges, one of the biggest problem statements that came out of that is the need to create an innovative delivery model to carry healthcare to the homes of beneficiaries in Borno State, for example, because if they go to facilities, they're at high risks of explosions. In a state like Lagos, one of the problem statements was around developing the surveillance systems and the forecasting tools to prevent Ebola from happening again. So bespoke problems that, if addressed, will contribute to this movement to save 1 million lives.
Okay, now talking about the challenges in the Nigerian healthcare space, what are the barriers to innovation?
Sure, I think that it is important to start with the following. That if you look at many of other African countries, Ethiopia, Malawi, countries that have been able to meet their health MDG targets, they've been able to do that by spurring thousands of innovations, whether it is process innovations or product innovations or technology innovations or market innovations. Most of these countries have a convergence platform that help to identify, nurture, shape, scale up, and invest in promising innovations. In Nigeria, we do not have that. In Nigeria, we continue to have constraints that impede our innovators from achieving scale and from having sustainable impact. The following constraints are the biggest ones. The first is the fact that most of our innovators do not have a support system or capability foundation to do better. The second is that there isn't visibility for our promising health innovations. The third is that our innovations lack a convergence platform to link them with money, with the capital required to achieve scale. In addition, there is a dearth of data, because in innovation you need to translate advances in innovation to evidence-based knowledge products. And lastly, there isn't the coordination needed to develop community of practices that would help spur the kinds of innovations that would enable us save the lives of 1 million women and children in Nigeria.
Still on the challenges in Nigeria's healthcare sector, do you think we can ever attain effective universal healthcare coverage in this country?
I would like us to take a step back. When we say universal health coverage, typically we mean three things. The first is, how do we increase the fiscal space to mobilize resources so that our vulnerable and poor women and children can be covered by health insurance? That's one. Second is that how can we undertake the sort of risk-pooling mechanisms to ensure that universal health insurance coverage is achieved? The third is, how can you ensure that the two aforementioned things plays a role in strategically purchasing care in a manner that good quality health care is received by our vulnerable women and children in Nigeria? I believe that the private sector can play an important role in those three areas: in mobilizing resources, in leveraging its capabilities and analytics to provide the right platforms for risk pooling. Thirdly, in developing the technology platforms and payment systems to collect money so that people can afford to seek care. And finally, private sector tools and expertise can be used to develop a quality improvement and clinical governance framework for the country. I think that in Nigeria today, there are more Nigerians that seek care in the private sector. In addition, the broader private sector, your financial institutions, your telcos, your FMCG companies, have the kinds of capabilities and resources that the health sector can benefit from. And this is why I think that the Private Sector Health Alliance of Nigeria is playing an important role in mobilizing the private sector to advance health outcomes through innovation, advocacy, partnerships, and impact investments. I'd like to end by calling more private sector leaders to join this movement to save 1 million lives of women and children in Nigeria.
Well, that was Muntaqa Umar Sadiq, CEO of the Private Sector Health Alliance.